guys, this is Gargi. Welcome to another educational video from the Dazzling Dentist. According to WHO, cardiovascular diseases are the number one cause of death worldwide. And among these, 85% are caused by heart attack and stroke. So, what is myocardial infarction? Acute myocardial infarction or MI, which is also commonly known as heart attack, is a clinical syndrome that results from the occlusion of a coronary artery with resultant death of cardiac myocytes in the region supplied by that artery. So, when there is occlusion of a coronary artery, there is stoppage of blood flow to the area which the artery supplies, and so it results in the death of cardiac myocytes. Now, what are the signs and symptoms of a heart attack? A very common symptom is left-sided chest pain, which radiates to the left hand, shoulder, neck, or lower jaw. One more symptom is suffocation or tightness of chest. There could be difficulty in breathing, anxiety, apprehension, or sweating. So, what are the risk factors for a heart attack? So, the most common risk factors are smoking, diabetes, hypertension, obesity, dyslipidemia, and family history. Now, what investigations we can do to confirm a heart attack? We can do cardiac enzyme test, that is CPK, CPK-MB, troponin C or troponin I. We can do LDH, that is lactate dehydrogenase test. We can do a ECG, that is echocardiogram, or we can go for a coronary angiography. Okay. Now, what is the treatment plan for heart attack? First is treatment at home. In this, put the patient in a semi-sitting position, console the patient, give tablet sorbitrate 5 mg sublingually, give tablet aspirin 150 mg orally, and then finally shift the patient to the hospital. Now, what is the treatment at the hospital? At hospital, put the patient in a semi-sitting position, give oxygen to the patient, go for a ECG, go for a troponin C test, and if positive, give tablet sorbitrate 5 mg sublingually, tablet aspirin 150 mg orally if not given at home, and tablet clopidogrel 75 mg 2 tablets orally, and tablet atorvastatin 20 mg orally, and all of these are known as loading dose. Now we will go for specific treatment. First is thrombolytic drugs, in which we will give streptokinase or urokinase injection. First 7.5 million units in 100 ml slowly intravenously in 30 minutes, and the next 7.5 million units given in 1 hour again in 100 ml intravenously and slowly. Next, we will give heparin injection 5000 international units subcutaneously twice a day. We will give antiplatelet drugs, in which we will give tablet aspirin 150 mg once a day and tablet clopidogrel 75 mg once a day. Next, we will give beta blocker, in which we will give tablet atenolol 50 mg once a day. Next, we will give nitrates, in which we will give mononitrate 20 mg once a day. Now, if the changes of ECG gets reverted back and pain gets subsided, then we have to wait Otherwise, take the patient for coronary angiography. So according to the findings, we will do further treatment. If there is more than 80% blockage of a single artery, then we will go for stenting. If there is more than 80% blockage of two arteries, then also we will go for stenting. And coronary artery bypass surgery is done if all three arteries are blocked and calcified. Now lastly, I will tell you about the complications of myocardial infarction. First is left ventricular failure, congestive heart failure, cardiac arrhythmia, acute coronary syndrome, cardiac arrest, or the most common, that is death of the patient. So thank you for watching. Hope you liked the video. Don't forget to like, share, subscribe and comment. And also press the bell icon if you don't want to miss any updates from the Dazzling Dentist.